So FaceTite is an invasive form of facial contouring from InMode Aesthetics. This is a device we brought on within the past year. Only a physician can perform FaceTite. I myself as the physician and then my nurse are involved in the procedure. Patients often will come in for FaceTite when they're looking for a one and done with facial contouring. They may complain of laxity in the lower face. More commonly, we see patients complaining of either a double chin or laxity in their submentum, and they're not planning on doing something that's maybe multiple procedures. They really just want something that's invasive, one and done. When patients come in for their initial complimentary consultation, we make sure they're an appropriate candidate. We also make sure that this is something that they would be able to tolerate. Similar to the BodyTite, when patients come in for FaceTite, we make sure, again, that they're an appropriate candidate, but also that they can tolerate the procedure. They're awake. They are talking to us through the entirety of the procedure. They may fall asleep for a minute, but we do prescribe something for them to relax, something for pain. But they are in our sterile procedure room in the back and awake during the full procedure. We do what's called a tumescence infusion. So I have a cannula that's inserted that pushes lidocaine through the area so the patient is completely numb. Occasionally they may feel a little poking and a little prodding, maybe a little heat, which we want to know to make sure we're at the appropriate level with our probes and our FaceTite piece of equipment. But the patient, this is a very well-tolerated procedure. Most of our patients have said that, they don't feel anything, and often they will doze off during the procedure. So this is very, very well-tolerated. This is one of the reasons we recommend a complimentary consultation. We often will have a phone call, patient requests, they want to be put on our schedule for FaceTite, but we always bring them in to make sure, first of all, we need to do a history and exam and make sure they're an appropriate candidate. But second of all, they may have seen a billboard or a commercial or maybe had a friend that received FaceTite, but that is not maybe the procedure that would either best suit them or that they would be a great candidate for. So the complimentary consultation is of utmost importance. With the FaceTite, this is our little probe here. So routinely we make 3 incision sites. So we're often treating the submentum. We'll have one incision site that's just here right under the chin, and then we'll either have one that's just here right in front of the lobe of the ear, or we may be right behind the lobe of the ear. We go in first with a cannula that numbs the area with that tumescence lidocaine. Make sure the patient is very comfortable before we proceed. We then make sure that the area between the fat and the surrounding superficial tissue, that we're able to create a good surface area, that then the probe for the FaceTite can be inserted. We want to treat the area with appropriate temperatures to get the 50% or more improvement in skin laxity and then facial contouring. So the device is heated up to 68 degrees Celsius internally, and then the external probe, this is placed on the skin, heats up to about 38 degrees Celsius. We ensure that we get appropriate internal and external temperatures. This would be applied to the lower face and then also to the submentum.